Okay.
All right. Hello, I am Linda Heitzman-Powell, and I serve as the chair of the Behavior Analyst Advisory Committee for the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being held remotely by conference call and other electronic medium. Denise Seisman. Not here.
That's correct.
Allison Bell.
Here.
Alec Bernstein.
Present.
Wes Dotson.
I do see Wes on the call.
Yeah, I'm here.
All right. Kelly Harrison.
Here.
Emily Kessler.
Here, and I'm going to turn my camera off because I haven't had lunch yet, so I'll turn it back on after I finish.
Pamela Neidert.
Here.
Christy Marie Steele.
Present.
Stephanie Wiley.
He is just logging in. It looks like her audio is just connecting. So he is
Mike Williams.
I'm here.
Hi, Mike.
Hi.
And Alice Jean. I don't see Alice. Okay, so Nikki is here.
Here.
Yep.
Okay. I also note the following BSRB staff members are present. David Fye.
here.
And is Leslie Allen joining us?
He will not be joining us today. I've tried to give her a little bit of time to work on some other things. And so she'll be just joining us in future meetings when we're dealing with regulations and things like that.
Okay. Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this public meeting remotely, I state for the record the following information. Access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On October 14th, 2024, we sent notice of all the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with a subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the line, but if I hear someone beep over and announce themselves, I will let you know.
Okay.
Also, during the introductory information, Alice was able to begin. So,
She just jumped in.
yeah, so she's in attendance as well. Yeah.
Okay. All right. So the meeting is now called to order, and the advisory committee will begin its discussion of the first item on its agenda, which is the agenda approval.
I motion to approve. Christy Steele.
Thank you, Christy. Do I have, and Allison seconds?
Yes.
All in favor, say aye.
Aye.
All opposed, same sign. I copied that off the site committee. All right, the motion carries and the agenda is approved. All right, so now we need to move on to the approval of the minutes from our previous meeting. So if you guys will take a minute and look over those notes if you have not done so already. And when you're done, I will entertain a motion to accept the minutes unless there are any amendments.
I move to approve the minutes.
Thank you, Wes.
Second,
Was that you, Kelly?
Nikki.
Nikki? Okay, thank you, Nikki. All in favor, say aye. Aye.
Aye.
All opposed? All right, motion carries. Thank you. So now we move to the next item on the agenda, which is the executive director's report.
Thank you, Linda. I'll start with a couple of operations updates. The first one is that we have been in the process the last few months of rolling out the implementation of the board working with a company called CE Broker. And we provided a few updates to you about CE Broker earlier this year, but just as a reminder, what CE Broker is a private company that works with state licensing boards like the BSRB. They previously have reached agreements with the Board of Healing Arts and Board of Nursing in Kansas. And they provide a free service to licensing boards and also a free service to licensees. They offer a platform so that when you complete continuing education, you can take the documentation that you've completed that course, and then you can upload it to their portal, and you can assign that in certain categories. And the benefit is that if you when you go to renew your license, if you're pulled for audit, usually during that process, there's a process of sending information back to the board, being reviewed, verification that you've met all your hours in the right categories. Under this process, if you utilize CE Broker and upload the documentation and assign it to categories, and you're pulled for audit, we can log into that portal, view the information, and approve your audit very quickly. So it is a free service. We have rolled it out for 4 professions. We still have 3 left that we're rolling out by the end of this year. So we should be sending out some announcements about that in the very near future, probably by the end of the year. But that is something we encourage people to sign up for when you get a notice about it. Like I said, we're only about halfway into the rollout, but we have about 3 more professions still to be added. Allison, I thought you had your hand up. Did you have a question about that?
I got audited this year. It's the first time. It was a good
Oh.
experience. But that would have been very helpful because I think I just had to like fax or /snail mail all of my certificates. It was pretty quick. I was very happy with how quick it was, but it'll be nice that we won't have to do as much moving forward.
Yeah.
I got audited too. And
Did you just select the board to audit this year?
yeah, it's weird that they ask for the original certificates, and like a lot of CEUs come online now. So I was like, so I just emailed everything in, and I think it's all good.
Yep. I said the same thing. I'm like, original. What is an original CEU certificate?
Yeah, that's part of the edits we're encouraging all the advisory committees to make right now. We're going through and cleaning up some of that language. So some of the past CE regulations referred to like audio tapes and videotapes. And it's like, well, we've changed a little. So not to say those don't exist and they're not out there being used, but video, audio recordings, and original copies not really necessary when we have electronic copies for everything. So
Yeah.
This
And I think back in the old days, they wanted the original one with the wet signature on it, right? So that people could tell it wasn't forged.
Yeah.
But people don't do that anymore.
I'll say that doesn't exist anymore. So.
Yeah.
Yeah. But this will be nice. We did make sure that in the agreement we reached with CE Broker, this is not a requirement. Some states require it of all licensees, and some states audit all individuals upon renewal. So we only audited about 10% upon renewal, but we wanted to make sure that it was optional. So nobody has to do this, but we encourage everybody to do it because we think it's a nice service, and it's a better way of doing things than just kind of holding on to the records on the off chance that you might get audited, it's better to kind of keep them in a place that is secure. And then CE Broker also provides some options for other CE courses if you want to look around through their portal and find things. And recently, the board had a conversation. Social work has a process where we can do pre-approved CE courses. And they had asked for that a few years back, and we had designed a process for that. The reason we don't do that for all of them is because if we had to review every CE course that came through, that would take up a lot of additional staff time, and we would need more people to do that. So we give clear guidance in terms of what the regulations say, but for social work, there's a particular process where someone can pay a fee and become a official BSRB pre-approved CE provider, or they can have one course deemed pre-approved by the BSRB. And so with moving to CE Broker, they provided a portal for us to have other people sign up to become CE providers. And so we thought this would be the right time to bring it back to the board and ask, with the board's support, we would like to open this up to the other professions. Nobody has to become a pre-approved provider or have courses pre-approved, but if they would like that for advertising or for security purposes, we'd like to be able to provide that to the other professions too. And the board was supportive of that. So we'll try to get that passed to the legislature this spring. But that is something also that CE Broker is offering, is that portal where you can have providers sign up to offer their CEs through CE Broker, at least advertise them that way. And
then are they free then for the people that access them?
I don't think they're free.
Okay, because I was thinking that'd be a great benefit.
It would. I agree. It's probably come up to the individual providers if they choose, how they choose to do it. But yeah, I think it'll be nice. We're kind of in the implementation stage, and we're trying to work out a couple of items. I think behavior analysts have not been rolled out. So they're probably one of the last three. But when you do get that information, it'll provide a link so that you can put your license number in to be able to activate your account. Just make sure that you include the letters for your license, a space, and then the numbers. If you just put in a number, it sometimes sends people to a veterinary page because the eBroker works with lots of different groups in different states. So one thing we've just found that we're trying to help people with. So, but yeah, it's been going pretty well. That process is smooth, and we're looking forward to continuing to have more people sign up for it. So in terms of another operating update, we're almost at the end of the calendar year. Every year, the legislative session starts in the spring. And usually by about the second week in January, the legislature is starting to hold committee meetings, getting close to the governor, putting out the governor's recommendation on state agency budgets. And this year, the legislature is taking a more active role in the budget process too. So we expect both the governor and the legislature to release a bill as a starting point for appropriations and then kind of work from there. So in my role as executive director for the BSRB, I put together a budget every September, and it includes revisions to the current year and then at least one future budget year or sometimes two future budget years. And then the governor makes recommendations on that. And then during the legislative session, I go before House budget committees, Senate budget committees, answer questions, and then they can make additional changes. So that'll take up some of my time in the spring. And then additionally, if there are items for the legislative agenda for the board, we will go to the health committees and request introduction of legislation to accomplish those things. If there are other bills that are relevant to the BSRB or might have a connection, I may go over to the Capitol and provide testimony on those bills as well. So I will keep you updated throughout the spring as we have advisory committee meetings and just let you know sort of what's going on politically. But one item that I did find out just recently in terms of legislative news, they named the chairs for the House committees, and the chair for the House Health and Human Services Committee, which is most likely where we would be going on the House side, is the new chair will be Representative Will Carpenter. And I don't know if any of you are familiar with him, but Representative Will Carpenter has worked in the legislature for several years. He had previously served as the chair of the Social Services Budget Committee. And so he had served in that role for several years and worked with the budgets for the Department for Age and Disability Services, Health and Environment, Department for Children and Families, the state hospitals. So he's very familiar with the health system in the state of Kansas. And I've been really happy to work with him over the years. I actually worked really closely with him when I was working for the Legislative Research Department way back when. And so
what was his name, David?
His name is Representative Will Carpenter.
Carpenter.
Yeah. And he previously, just recently, I believe, had served as the chair of House Fed and State. So I'm looking forward to continuing to work with him in his new role as the chair of the House Health and Human Services Committee.
Thank you.
One other item I do try to provide to the advisory committees is updates from recent board meetings. And there was a board meeting that took place about a month ago in November 4th. And so just a couple items from that board meeting. There were some recommendations that had been forwarded to the board for consideration. One of those was from the Marriage and Family Therapy Advisory Committee. There is language in their Construction of Act statute, which basically says more or less people providing marriage and family therapy services need to be licensed by the BSRB, with some carve-outs. That one of those carve-outs was individuals that are students or interns at the academic location, basically. But there was also some strange language that said, it said students, interns, or individuals preparing for the practice of marriage and family therapy. And that language was a bit vague, and we were unclear who that was intended to assist. And it creates sort of a vague standard in trying to define, who has supposed to be licensed and who's not. And so we did some research into the statutory history, couldn't really find anything specific to that language. It only appears in the addiction counseling and the marriage and family therapy statute. So we brought it to both committees, and both committees ultimately recommended removing that language. And so that recommendation was forwarded to the board, and the board agreed with that as well. So the board will request some statutory changes just to take care of that language and remove it from the statute. There will still be the traditional carve-outs of, students or interns, just not the preparing for the practice of addiction counseling or preparing for the practice of marriage and family therapy. In terms of some items for other professions, for licensed psychology, there was a recommendation from the advisory committee. Currently, their education regulation says if you received your education from an APA accredited school, you also need to meet the specific coursework requirements in the regulation. The advisory committee recommended a change that is more consistent with the other professions, so that if you receive your education from an APA accredited program, that would be sufficient to move you forward through the process. But the specific coursework requirements are more particular for individuals who apply from non-accredited programs, which is how a lot of the other professions use that coursework requirements and program level requirements. They really provide an alternative path for people from non-accredited schools to try to establish equivalency. So that recommendation was approved by the board as well. And then there was also a recommendation by the Professional Counseling Advisory Committee. There's been a lot of discussion about who can provide supervision to people seeking a clinical level of licensure. And that profession basically has had a lot of discussion about, should it be limited to just professional counselors? Should there be flexibility to allow people outside of that profession to provide supervision? Ultimately, what we are hearing is there are individuals from other groups who are going to be likely advocating for more flexibility in that area. And what the advisory committee proposed as sort of a compromise solution was language to the board that would say half the supervision hours would need to be provided by somebody who is a clinical professional counselor, but up to half of the additional hours could be provided by someone from another profession, as long as they had sufficiently a high level license from another profession under the BSRB. So the board did recommend that item as well. So also just one note, I know some of you kind of track what's going on for other committees as well. And some of the conversation for the licensed psychology profession has been concerning their test, the EPPP. Linda and I were able to go to the annual meeting for the Association of State and Provincial Psychology Boards. And there was a lot of difficult conversation about that test. What has happened in recent years is the board of that association made a decision that as of January 1st, 2026, they were going to require all states that wanted to use the licensing examination to have to require passage of a second test called the EPPP2. And so I know this is not your profession, but I think it's important as we kind of have all the professions working together that you kind of hear some of this conversation. And so that requirement of taking both tests and passing both tests was, as we got closer to that date, was going to be very difficult. Some states expressed concern about the cost because the EPPP is $600, part 2 is $450. If you pass part 1 but don't pass part 2, it basically acts as a barrier for you being able to go out and provide services. And currently right now, states already have the ability to require Part 2, but it's up to each state's discretion. And so by making that decision, the board of ASPPB had basically taken that out of the hands of the states and jurisdictions. And so Texas and a few other states had proposed a bylaw amendment for that association to try to prohibit them from making it a requirement to have both tests passed. The master's level psychology and licensed psychology advisory committees brought in representatives from ASPPB, heard about the development of the test, the reasons why the board may have made that decision, and then ultimately both advisory committees were asked, do you want to make a recommendation back to the board? Should we support this bylaw amendment from Texas? And both advisory committees said strongly, yes, please go to the annual meeting and support the bylaw proposed amendment. And so we were planning to do that. The board heard those recommendations and confirmed that. They said, go forward and, represent our conversation here. And so about a week before that annual meeting, the board of ASPPB came out with a letter. They had another meeting and they said, we are going to pause our previous plans to require passage of both tests. So they were basically changing their mind on that. And then there was a question of, does the bylaw amendment still move forward? We basically said, we're concerned about this language with the word pause, and we think the discussion needs to happen at the national level. So let's still move forward and have that conversation. And so at the annual meeting, there were some hard language. There wasn't vulgarity or anything, but there was really strong opinions on both sides. There was a desire to make sure professional standards are upheld. There was also a desire to make sure that states were not left without a licensing examination, and that states should have the ability to make this for themselves, and that the association itself has the ability to change, to work with its members so that the members really are the ones making the decisions. And so I thought the conversation was really productive in that manner. We pursued the bylaw amendment. Ultimately, it didn't pass, but with the board's decision to not make that a requirement, it did allow a new path moving forward. So for that association, they're going to start a task force in the spring, have individuals volunteer, and then work on a more comprehensive approach going forward in the future. But I thought it was a really good example at a national level of states having a voice and being able to bring differing opinions to the table, and then ultimately reaching a compromise and trying to work on something better for the future. So just kind of wanted to share that with you and let you know what's going on in those different areas. And Linda, did you have any comments about that experience you wanted to share?
Yeah, there's three things about that. The first thing is with regards to that amendment and the board, the ASPPB board, it's a composite board, right? So it's the United States and some provinces in Canada. So it's pretty big, right? And they made that decision unilaterally without consulting with the people that it was going to impact. And so I was really impressed with the ability of a handful of people to make a difference and effectively put a pause. Thank you, David, for your clarification of the word pause on that whole process, right? Because it was the ability to watch democracy and progress. And I just want to say that never forget that a handful of people can make a difference, right? So I think that's a really important lesson for us currently in this day and age. But also that there was discussion of the national trend for deregulation. And the previous example of deregulation was back a while ago when all of a sudden there was an explosion in like snake oil vendors that would go out and say all these things are going to make a difference. So that just needs to be on everybody's radar, that there's this trend towards deregulation and to think about the unintended consequences of not regulating our profession, right? So I think that's important. And then the other thing that sort of stood out was the Behavioral Sciences Regulatory Board here in Kansas. We are a fee-driven or funded organization, which means all of the license fees and stuff goes to pay all these guys' salaries to make sure that the public is protected. There was this huge case in Canada, which was also a fee-funded organization, where somebody was publicly presenting misinformation, presenting himself as a psychologist, and was using it for political and personal gain. So the board told him to stop, and he ended up suing the board. Is that what it was, David? And they went back and forth, and that could have bankrupted that organization. And so I think sometimes we think the processes that we have in place are a little bit cumbersome, and but they're there to make sure they protect us, and that we're able to do what we do to protect the public, right? So those were the three things that happened that just sort of struck me this year, that I thought you all should be aware of. That's it.
So for the yeah, sorry, I was gonna let everybody know. So they're just along the line. So as someone that's pretty novel into the like advocacy piece of this role and this field, it took a long time for me to even like explore that as an option, because I was like, I do not understand the legislative process. I do not understand all of that. And so there is a training coming up on Tuesday, December 17th at 12:30. That's about defending federal health policy in the coming years. That got sent out to the Can Advocates group, which is where I've learned 99.8% of what I know at this point. And it's really more about like, how do we, because of the upcoming like administration and Congress exploring significant changes, like how do we help protect the most vulnerable? And so I know that it's not exactly in line with what we're talking about right now, but it also is kind of introduction into what do we do right now. So if people are interested in that and you're not in the Kansas Grassroots group, I can email you the link to sign up for that. Or if there is anybody else that's interested in it, I'd be happy to share that, because I'm excited about that one, because I think it's going to be a lot of information. So.
And that is directly in line with what we're talking about, especially when we say deregulation, because if they change federal health policy and decide to address the work shortage by deregulating professions, it's really could potentially have a negative impact on the public.
I'm also interested in it from the aspect of like just advocating at a federal level anyway, because of the conversations around the defunding or the disintegration of the Department of Education. And so like that's also important in this field and scope. So okay.
So David, are we able to share that link? If Allison sent it to you, could you?
Sure.
Yeah, okay.
I'd be happy to do that. Yeah.
All right.
And I do think, yeah, it's really the legislative process can feel uncomfortable. There is a lot of formality, and there are some unusual rules and certain things. One thing that you could do if you are interested in taking a role at the state level, so similar to the BSRB having a YouTube channel, the Kansas legislature also has a YouTube channel, and all of their committee meetings are broadcast. And so if you are interested in doing this, you could look back at some committee meetings from last year. You could even go to the legislature's website, and they post the agendas from past meetings. You can look up individual committees, go to a certain date. So you might find a topic that's of interest to you, and then find the YouTube broadcast for that, and then kind of see how people choose to talk on different subjects. I think one of the most challenging things is, let's say that you are getting ready to present testimony, and you have a well-written page of information, and then you show up to the meeting and they say, thank you for coming to the meeting, but based on the volume of people who want to testify, everybody will get 2 minutes. And then how do you pivot from having your remarks that are probably going to take about 5 and really condense them in a helpful way that is 2 minutes? And so
use AI.
But you know, in the moment, but really one of the things that we used to do back in the old days was we made sure that we had 2 or 3 talking points. These are the 3 highlights, and everybody that was advocating for a particular position, they stayed on point with those 3 bullet points, right? So when it comes down to, because that happens a lot, David, that happened a lot when we were trying to get insurance coverage for autism. But if you just highlighted each one of those bullet points, then everybody was on the same wavelength, right? And they heard the same thing from multiple people. So I think that's important. So thanks for sharing that, Allison, because there are guides out there on how to be an effective advocate for certain positions. And I think that's a good thing and especially when it's designed to protect the public, which is what we're all here for, right? Yeah, I think that's a good addition to all of our professional repertoires or personal.
So I have a quick question. I know that we probably talked about this in the past, but when we are going out there and doing advocacy work, we are supposed to do it as a citizen or as someone just not connecting to what we are doing here as part of the committee, or for Linda and I, not part of the Key Medical Center, right?
I
Or
appreciate
that's the only
you
thing.
bringing that up. Yeah, that's kind of a tricky thing. So you are definitely free to tell people that you serve on the advisory committee for, the Behavior Analyst Advisory Committee for the BSRB. You just want to make sure that if you do give comments at a committee meeting or you talk on a subject, unless the committee has basically delegated you the authority to talk on their behalf, or unless the board has delegated that authority, you just need to say that these comments are from an individual level. So I'm not speaking on behalf of the board or the advisory committee. These are my comments, but it's okay to say that you do serve as a member of the advisory committee. So that's kind of
And yeah, and if you work for a nonprofit, just make sure you check the current federal regulations about what percent of employee efforts can be directed towards advocacy. Because I'm making this up, Allison. Let's pretend that you want to speak on behalf of the Grassroots, which is a nonprofit. You have to make sure that you don't go over whatever percent. It's that the organization's primary concern is this, not advocacy, because that's a totally different organization. So just to be cautious and make sure all your I's are dotted and your T's are crossed.
I just say I'm wearing my BCBA Allison hat
Yeah.
instead of any of the other 15 that you would like to choose from.
Yeah.
one comment, one of your recommendations has gone to the board and it's been recommended by the board, so it will require a statutory change. And that is the recommendation you put forward to add a 13th member to the board, one for behavior analysis. So the board has recommended that as well. So we will be requesting legislation on that topic. If I'll be working to try to get a hearing for the bill, and I will let you know when the hearing is scheduled. And so I will let you know too, in terms of what I've seen make the biggest impact, and in terms of members of the committee. People can do written only testimony, which is helpful, but it's so much more powerful if somebody is there, especially if they're able to go in person and speak at the podium, even for a couple minutes. It's just helpful for the members of that committee to really be able to put a face and a name to some of these things. Yep. And to really hear directly from the different people. So if you're able to do that, I would encourage you to do that because it does carry a lot of weight.
Y'all are not excited enough about this. I did not see enough yays for that, first of all.
Yeah.
Thank you, David, for doing that. And second of all, did you say the date when that's going to be? Or
yeah, I was going to say, I don't think there's a date yet, right, David? But since you're connected to what's happening on the Hill, so to speak, are you able to say, oh, tomorrow, I've found out that tomorrow at 10 o'clock is when they're going to be hearing the proposition to add a 13th member to the board?
Yeah, so basically, The next step is there's a short 1 hour board meeting for the BSRB board on Monday. And that's from noon to 1, and that is really for the purpose of finalizing items for the legislative agenda. And then the next step will be taking the final proposals from the board and then having them basically be introduced in front of a committee. So people from the public, we don't have the ability to request or to introduce bills ourselves. What we can do is we can go to a committee and ask a member of the committee if they can do a bill introduction for the bill that the board is pursuing. And then once the bill has been introduced, it'll be available in the packet. And then behind the scenes, what I do is I talk to the chairs of the committee and I say, do you mind if we have 15 minutes and I'll talk to you about a bill the board is interested in putting forward, or maybe half an hour. And then I'll go through those things with the chair and then ask, would you be willing to schedule a hearing for the bill? And then once I get that information, I can send it out to everybody. So they do try to give people a little bit of notice because there are certain rules with testimony. Generally, if you want to present testimony, that has to be into the committee assistant, usually about 24 hours in advance, to make sure they have it so they can upload it to the website in advance of the committee. So sometimes that window is very close, but as soon as I find out, I'm going to email it out to everybody so everybody has the opportunity, if you want to present testimony or view the meeting or be there in person, that you have the opportunity to do that.
That is just so awesome. Yeah, thanks. I feel like thanks to a lot of people's work, but particularly Linda and David, that's just wonderful. My question is, absolutely would appreciate a notice ahead of time, and also like I guess this might be a weird, tricky question. Like, how much do you think testimony and those type of things do we need to, is this a high effort thing that need to get this passed, or maybe it's not some, I guess, is it helpful to even get people outside of being behavior analysts, but maybe consumers to be there and things like that?
So I'll just be direct with you. I think for some members of the legislature, they may not know a lot about the behavior analysis profession. So I think visibility and being able to make those connections and educate people, I think that's really, really valuable. And I think there may be the impression by people who've maybe only heard about the profession that they might say, oh, well, it's just a handful of people. But if they hear from a lot of people, that may change minds. And so, just based on what I have seen, those kind of things do carry a lot of weight. And in terms of the testimony, sometimes there's very little notice in terms of when the hearing is going to happen. Sometimes what they do is they publish the next week's agenda, but sometimes those things get revised, and sometimes there's a tiny little window of time. And sometimes it's more of, I get a courtesy phone call or somebody stops me in the hallway and says, hey, by the way, this is going to come out in the calendar tomorrow. And so I try to use all the information that I can get. But what you can do right now is, if that is something that you want to be in support of, you could go ahead and draft like a 1-page piece of testimony now and just have that ready. And then whenever the hearing happens, modify the date and then submit that. So that way, if there is a really short period of time, you don't have to scramble in that moment to put it together. So just a suggestion.
So one of the things maybe that we could all do now is just start letting people know that we are trying for representation on the board, that it failed last time. Make sure you let people know it failed. And so right now we're being governed by a psychologist. So even though that psychologist is me, it could not be me, right? It could be somebody else. And just start getting people potentially excited about being able to go have their voice heard and have a target number. We want 100 people to show up and, 20 families or something. And so that would be one thing I think that we could do independently of this. But David, you said something. You said change the date on it. Is there a specific format for that public testimony, like date?
I mean, what
Charlie?
I'm usually seeing is, people have, it's from an organization, sometimes it has the letterhead on the very top, and then it has a date, and then it says, um, you know, chairman so-and-so and members of the committee or something like that. But there's
Okay.
examples of that type of testimony that are on the legislature's website. So you could even
Okay.
look years off of someone introduced it before, but you don't need to submit something that is like 20 or 30 pages with the history of the profession or
Right.
something like that. I think Linda's comments about having 2 or 3 really good talking points and bullets, that's really helpful, especially because sometimes members in the committee will pull up your testimony if you are speaking, and they will do a quick scan and try to identify what are the real big takeaways. And so that's
Do you
it.
have the numbers, or can we somehow get the numbers on the number of licensed behavior analysts in the state of Kansas and the percentage
Yeah.
of that population to how many people they actually certify across all of the professions?
Yeah, David has those numbers. Are you able to share those with us, David?
I can
Like total number of licensees, and then what is the population of just behavior analysts?
Yes. I have that pretty handy, actually.
Well, give it to us. I
And
want it.
We're one of the fastest growing professions.
Yes.
yeah, in terms of how many people they're serving, that I wouldn't really have access to that, but I'll share my screen here and I'll show you a chart here that I provide to the board every full board meeting. So,
Well, David's pulling that up, also to mention in terms of awareness, like you were saying, Linda, getting the word out that we don't have representation on the board currently. If we can get those questionnaires sent out to the LBAs, that question in there of are you aware and is that important to you? That could kind of start getting the word out as well. So we could prioritize.
That's a really good
getting that
idea,
out.
Christy.
Thanks.
Because we are going to talk about that's the next thing that we're going to talk about. We're going to bump the annual training down. So that's our next topic of conversation as under old business, the continued discussion on the survey.
Great.
Yep. All right. So look at can you see these numbers, you guys?
Yeah.
and I know there's a lot of numbers, so I'll move to page 2 for a second and we'll come back to this. Page 2 is basically the same data, but it's been condensed. And so when there's tiered licensure between professions, it all gets kind of grouped into one line per profession. So for the behavior analyst here, started around 144, but it is one of the fastest growing professions. And now I would guess if we check the number now, it would be over 500 combined between behavior analysts and assistants. So,
And then the total number of licensees is almost 16,000.
yeah.
Yeah. So, Allison, one of the things that I look at when I look at this is like, we might be the lowest number of licensees at this point, but look at total LMLPs or LCPs, right? That's psychologists, master's level psychologists. There's only 623 of them. And
the number stable since 2016, relatively.
Yeah.
Yeah, I think that's what
Okay,
stands out
you're
to me the
right.
most is that, yes, we have the fewest, but we seem to be rapidly growing compared to other areas that are stagnant or maybe
Yes.
even decreasing a little bit.
Yeah.
I was also thinking this might be a good thing if we could send it out through Kansas Grassroots and Kansaba. If we could even give people that letter to fill out and then let them know to watch for the call for those letters and the call for the meeting, so then maybe they'll show
I was
up.
gonna make a template letter and post it in
Yeah.
Grassroots. I just didn't know if
Yeah.
anybody I was gonna do that.
Yeah, I like all those ideas. As someone coming in from out of state, I think the really important piece is being Kansas specific. So I really love seeing these numbers for this state. And I liked the idea of what are the 2 or 3 key points? I think if we're going to send out something to Kansaba or the statewide group, we need to make sure or someone has prioritized what are those talking points. Like every one of these letters we advocate need to have these 2 or 3 bullet points, because I think looking at this, what was just said seems really vital. This idea of okay, yeah, we're small, but we're already within 100 of psychologists,
Yeah.
whatever that may be. Yeah.
Yep. I agree. So we're one of the fastest growing professions in Kansas. And that as such, we have no representation on the board. I think those are two critical talking points. But you know,
Fastest growing, and what was the second one? Sorry, Linda, I was typing.
we have no representation on the board. We're represented by a psychologist. We could actually be represented by a substance abuse counselor if there were no psychologists that were able to chair the subcommittee, right? It would be any member of the board, some of which are somewhat outside of our practice. We could be governed by a social worker, right? Which are all great professions in and of themselves, but they're not behavior analysts. And so,
Well, and,
right.
and you know, to me, the model that we have in Kansas, the composite board structure, that's a very popular model right now. What I'm seeing as a trend is I'm seeing states like Utah and Iowa and at least one other that their legislature recently took a lot of separate boards and said, we think we could be more efficient if we combined and had one board, and then had basically standing subcommittees. So they basically took our advisory committee structures. And so what is working here, I think, is catching on in other states too. But I think part of that is you do want to have a representative from each profession as part of the board so that there is a voice from each profession when you combine it into one. And so.
And just like general context, every single, if you look at all the professions that are part of our composite board on the BSRB website, every single one of them has a representative on the board except for us. So
Is there a website for the Kansas Grassroots?
It's a Facebook group. It's really not that official, guys.
That's why I can't find it. Okay.
We are also not a nonprofit because there is no money. There is no exchanging. There is just a bunch of people that all got into a Facebook group together.
Okay.
But it is really efficient at getting the word out.
It is actually quite efficient, but
And just to let you know, in terms of possible questions that could come up from adding a board member, one of the things that whenever we have a bill, they always ask us to put together feedback for a fiscal note to say what would be the cost. And so expanding the board from 12 members to 13, logical question could be, what would the cost be to the licensing agency? And honestly, that cost is not going to be very much. We have gained a number of efficiencies over the last few years by being able to broadcast our meetings more efficiently. In the past, I think the vast majority of board meetings and advisory committee meetings were all in person, which restricted who could serve because, you know, a lot of people, it would be too much to ask for someone to drive all the way across Kansas to serve on an advisory committee 2 hours every other month, you know. But by being able to do it in this format, you know, if we added another person to the board and they attended remotely, there's no mileage reimbursement. It would depend on what the person chose to do. But even things like that, just to let you know, in the statute, our board members, I believe, get like $35 per day per official meeting that they attend. So cost is not going to be an obstacle. And I think the biggest talking point may be in terms of persuading members of the legislature, maybe volume for them to kind of be educated on the profession, to see how important it is to people from that profession. But in terms of if anybody were to raise that in terms of your conversations with people, the cost factor is really not a big factor.
This is more of a rules question because I don't want to break a rule. Can I have Linda look at the letter I just made outside of this context?
Yes, that's fine.
Thank you.
Yeah,
Linda, I'm emailing you.
So one of the things here is, since it is related to the work of the BSRB, because it does involve the bill, it wouldn't be appropriate to send it to all the members of the advisory committee and collect feedback outside of the meeting, because that would be the interactive component with the majority of members talking about the subject matter.
Yeah.
But with just a handful or just 2 people, there's no problem there at all.
Well, thank you, David, for that, broaching the subject that, you know, and, you know, of all the committees and we are pretty engaged. So I want to let you know that I appreciate your engagement, right? The more you're engaged, the more we can make things happen. So thank you. All right.
And I guess as the last point in my report, I do want to say that.
Oh yeah, he's still in his report.
Well, so I do want to say, we'll probably touch upon this at the end of the meeting, but since we have the training, I did want to say I appreciate all of you on the advisory committee. Thank you for volunteering your time this year. I've enjoyed working with you. Our discussions have been really beneficial. The role that you serve is incredibly valuable, especially because of the composite nature of the board. So thank you for volunteering your time. And if we don't get a chance to connect before then, I just want to wish you all happy holidays, and then I look forward to working with you more in the next year. So I'll officially end my report and see if there's any additional questions on anything we talked about.
Right
All
back
right.
at you, David.
Thanks.
All right. Are we ready to move on?
I think so.
Yep. Thank you, David. Actually, I do just want to say one more thing. At that meeting, David is the one that got them to define the word pause. So, you know, we're really thankful that we have David and that he is an attorney and he has our best interest at heart. So anyway, we're going to bump the annual training, right, David?
Yes.
And we're going to start that at 2:15. Is that correct?
Yes.
Okay, so probably we have a couple of old business agenda items, but since it is already 5 till 2, we may just get to the possible survey. And if so, then we'll just bump the rest of those items to our next meeting. Does that work?
Mm-hmm.
Okay. All right. So if everybody would pull up the possible survey that David sent out.
Well, everyone does that right. You said the 13th member of the board, right? Because there's 12 right now.
That's correct. Yep.
Okay, thank you.
So it's probably going to happen this year because it's Friday the 13th and we will be the 13th member. Not to engage in superstitious behavior or anything.
Oh, I do. Stay long.
Should I turn around in a circle 3 times as well? All right. So David, are we allowed to put that question in here? Whoops. On the, are we able to add question 20 so we can have an even 20 questions? And the 20th question would be, are you how would you phrase it, Christy? Are you interested in, are you aware of the fact that as a behavior analyst or that is licensed by the BSRB,
That's already question 12.
Is that question 12?
I thought there was when we started to address that. Yeah. So question 12 says Kansas statute describes the composition of the board, including 8 professional members and 4 public members. Statute specifically states there will be board members from other professions such as social work and psychology, but does not list a behavior analyst on the board. You believe that amending the statute to add a 13th board member for the BSRB by specifically listing a behavior analyst as the board member would contribute to the board's mission of protecting and serving the consumers of services offered by BSRB licensees. Why or why not? And I realize that that is in Dave's speech, and so it's incredibly wordy. So if there's a more efficient way to ask that question, please feel free to offer edits on that.
Go ahead.
Oh, sorry. I was just going to say, is that really the question we want to ask, though? Because that question is essentially saying, do we even want representation on the board? And I worry that asking it that way presumes someone might say no. Are we more interested in either why they think it's important or I would work like if we asked let's use democracy here. If we put it out to 500 people and 300 of them say no, and we as an advisory board might have to say, yeah, you're right, we didn't need representation. But that just feels like the wrong question. I'm not quite sure how to tweak it, but I don't think we're asking, do you think we should do this? Yes or no?
Well, after Monday, we'll know for sure what the board's legislative agenda is. And I think since the board has already made the recommendation to support this recommendation from your advisory committee, another potential way of wording this could say, the board of the BSRB is seeking statutory language to add a board member for the behavior analyst profession. And so just come out with that as that's the direction the board is wanting to move. And then maybe ask why you think that would be helpful or important or something like that. You think that would be a better way of approaching that?
Yeah, I definitely think it's more, and I also think it's more honest. Like if we're already moving to make this happen legislatively, I think it's a little disingenuous to ask, should we do this after it's already done?
I
So
think
yeah,
originally we were asking, is this something we care about? But I think now that it's not that question anymore. So I agree, Wes.
I think you're right, Allison. Like when we first started talking about this, I think we were thinking that this would go out beforehand so that we would have this as, 85% of the respondents said that they thought it was important that we had representation on the board or something like that. But yeah.
And that could still be important information during the testimony of, other behavior analysts were surveyed, the licensed LBAs, and this percentage of them strongly feel that they.
Can we, instead of making it like an open field answer, can we like put a Likert scale on it and say like, how important is this to you that you're represented on the composite board versus like, tell us about it?
I like that a lot because I think that makes, we're moving this direction. How do you feel about it? Seems more what we need.
Yeah.
My question is, when is the survey going to be out? Are we able to use the survey for the testimony at all?
Yes,
Well, I think we're hoping to get this done today, right, David?
that's right.
Yeah. So that then
And
it
we
can
would
go
be able
out.
to send it
Yeah.
out pretty soon.
Yeah.
Yeah.
How long are we giving them to respond back?
I was thinking maybe about 2 weeks. And then what we did through SurveyMonkey for the social workers is there was a specific email sent to specific licensees. So that way, the link didn't end up on a message board somewhere. We actually knew who was responding to it. But also if someone hadn't answered it yet, we could send targeted reminders. So if people had answered the survey, they wouldn't keep getting messages about it. But if they hadn't, we would send about 2 or 3 reminders to let them know you still have time.
Are we telling them we know who if they fill it out or not?
I mean, I know the way it's set up is just for anybody who hasn't responded yet to get the reminder, but the actual results will be anonymous in terms of what people respond to the actual survey. So
Like people are probably not going to say if they're unfamiliar with our unprofessional regulations if they know that who is responding to that.
yeah.
Like who's going to be like, yeah, no, I don't know, and I've been licensed for 5 years. No one. So
On this one, what do you all think? Is it important to ask a question about should there be a board member for behavior analysis on the board, and then rate the level of importance, or just make the change and just say, rate the level of importance of adding a behavior analyst to the board?
I think it's just rate the level of importance because like I said, we've already kind of moved. So I think this is the direction we're moving. What's your level of support for that? Or how strongly do you feel? That's the wording I'm struggling with, but I think that's the better question.
Do we want to get any feedback or talking points from this audience? If not, then we don't necessarily have to have an open-ended question.
I actually think that if we're open to increasing the response effort of asking an open question, then we could incorporate that into testimony of like, this is what behavior analysts from the field reported, why this is important to them, or it could support like our own testimonies, give us like more input of why it could be important that we haven't thought of yet.
Highlighting some of the
And of
comments.
course, it's optional. So you could do the Likert scale plus, like, if you'd like to provide more information or something like that.
Okay.
I just like the Likert scale because then we can be like, the 85% think it's very important versus having to go through and try to analyze paragraphs of if they think it's important or not. Efficiency is what I got out there.
I think.
So that sentence, sorry, Alice, go ahead.
No, go ahead.
I was going to say, so that sentence that you just typed, that's going to replace the sentence that says, do you believe that amending the statute to add a 13th board member, blah, 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 right? Yeah, it's going to replace that. Yeah. Thank you.
Yeah, and I'll clean up the phrasing a little bit, but
Okay.
something like the BSRB.
Yeah. Except for that's kind of redundant. Behavioral sciences regulatory board. Sorry.
That is always the hard part when you have the word board as part of the acronym. Yeah. Yeah. Maybe the board of the BSRB.
There you go.
Would you all like an open-ended option plus the scale?
I think it doesn't hurt if for the reason of incorporating those into the testimony. Like maybe there are points that people thought about that we didn't think about.
So maybe the scale, and then afterwards, please explain with the text box.
Mhm.
And they
And
can,
it could be optional.
yeah. That way they could rate the scale, and then if they had some additional comments as far as why they thought it was important or why they thought otherwise, they could fill in the text box there if they wanted to answer that. Okay. And I know we got through some of these questions during the last meeting. I don't recall exactly where we stopped. I do think there was a question as far as the definition of direct services.
Yeah.
We would need to figure out, how to quantify a workforce. There has been a discussion, at least for other professions, that, there may be, let's say, 1,000 people licensed, but if not all those people are providing services to clients, what's the right number when we're looking at workforce need versus how many people are in the field? But then again, I honestly don't know what the right number is in terms of what should the ratio be for people who are working full-time in the field. I mean, in your role as a behavior analyst, what portion of your day is providing services to clients versus doing the other things that are still necessary as part of your job? I don't know the answer to that.
I don't know the answer to, I think it's different depending on what level you're at. But even some of I think there would need to be a definition of what direct services mean, because some of the codes are, or even when you're, the definitions from the BACB are indirect is not considered direct, which means that you're graphing or analyzing the data. But if you're there with your consumer, that would be, you're directly involved with that individual. So I think the definition here would be a little bit different. I can tell you as a psychologist, over here at the Med Center, the licensed psychologists over in the behavioral health side, 80% of their time has to be billable, which is only billable if it's direct. So I don't know how tightly that translates to behavior analysts. But that's, you know,
I think when I was, when I can speak to Missouri at the hospital I work at there, our clinical BCBAs were 20 billable hours a week as an expectation. So out of a 40-hour week, 20 of their hours needed to be billable. But I think if we're, I've seen it up to 30. So some of my students who've gone on private companies have got, 30 hours of your 40-hour a week need to be billable. I've seen it as low as 10 or 15 for a more administrative clinical supervisor expectation.
Right.
So my clinical manager only had 10 hours a week that had to be billable because the other 30 were doing the administrative and indirect type work.
I think the piece that's going to be important to define though is, are you guys including like you working one-on-one with a kid and your supervision and your parent training and your assessment pieces? Because like those billable and non-billable, directed and indirect is usually used interchangeably, but it's not always the case. Like direct to me, I probably wouldn't account like writing an assessment, but it probably needs to be included in this definition.
Mm-hmm.
So do we want to possibly avoid the word direct entirely because of all those needs? I mean, are we interested in how much time do you spend interacting with clients or in the presence of clients rather than maybe directly clinically running a program? I think
at the heart of this is, let's say that there are people out in the workforce that are working as a behavior analyst, but they're doing part-time work. And so we want to have a way to quantify that because their license is still a full license. If we're counting number of licenses, it's a one, but in terms of quantifying workforce and available workforce versus what we need, if you're working part-time, maybe that would factor out to a full-time equivalent position of a 0.5 or something like that.
And sorry, David, Wes, I think the other thing, your example of somebody being, I think also at the intent of this is to see what kind of workforce do we have available to actually address the needs of clients in the field, because that's what we're regulating. We're regulating patient-facing activities. So the administration wouldn't count.
Right. Yeah. That's what I was trying to get at of like, are we after, we have 5,000 kids with autism under the age of, 18 in the state of Kansas. Best practice is 10 hours a week. We need 50,000 hours of capacity. How do we get there? And that, because so do we need to include the RBTs, the assistant behavior analysts, in this? Because they're often the ones who are going to fill out most of those hours if we're looking at it that way. That we saw that in the
not the ones that are going to be filling out the survey. So
yeah.
How about if it is in a typical month, what % of your work involves providing direct services or supervising those who are providing direct services to clients?
What if you just did face-to-face? Doesn't that meet the definition of what we want? Like, how often are you face-to-face?
I worry about the word direct.
Supervising without face-to-face with a client, right?
Right.
I mean, not necessarily. You can't bill for services that you're not face-to-face. And like include telehealth in the definition, face-to-face or telehealth. Real in-person time, here we are.
Yeah, I like that. I worry about the word direct just because I think that introduces, for those of us who are pedantic, what we're struggling with. Maybe it's just in the presence of or interacting with your clients.
Consumers of your behavior.
The only reason I'm cautious about that was though is in the presence of or interacting with. That doesn't need to be. You could be an administrator and be doing that. Yeah,
you're right. I mean, you could be having a monthly progress meeting and that's not the same thing. Yeah.
So look what David changed it to. What do you guys think of that?
Could we say something like implementing programming, or that would also kind of get toward
a definition
that you're doing something? Yeah.
Mhm.
You know, you're not just having a conversation or checking in, not just social validity, you know, not just team kind of progress meeting, but like you're implementing programming or supervising the implementation of programming.
But do we care about like the family components of this? Because there's going to be some behavior analysts that if we define it like that are going to say 0 because they only provide parent training.
Yeah, well, that'd be me right now. Yeah.
I would, because I provide parent training, I would consider this involving providing services. I am providing
Yeah.
services.
Yeah.
Yeah, and that may be a
Okay.
paren is like, yeah.
So at the end of that, it could say providing services to clients and or their families.
Or maybe just do a paren of is like providing services, supervising, and that could be a paren, implementing programming, parent training, etc.
We really, okay, yeah. We really just care if they're billing.
Yeah.
Yeah.
And I think part of this too is, you know, the part-time person versus the full-time person, but also let's say that there's someone who used to be a behavior analyst, but wants to keep that license current, but is no longer really working as a behavior analyst, but their license is still active, but they've moved on and they're doing administrative work with something unrelated, you know.
Or they're working in the schools. And
Yeah.
because they're not billing in the schools, that's not, you know, services to clients in home and community settings, right? Or center settings or whatever.
Do we have a question about the part-time? Because I would worry if you catch someone who is a clinical supervisor who maybe only has a 10-hour a week billable expectation, they would look very similar to someone who maybe is a half-time BCBA who's doing 10 billable hours a week as part of a 20-hour a week run. Do we care about that distinction, or do we just care about the total hours?
Good question. Yeah, I don't know. These are difficult questions, but they're important questions. I think what has come, the reason why we're kind of trying to quantify workforce, and I think, you know, how we got to this point a little, so it seemed like sometimes we were on opposite sides of the room in past legislative meetings where people were saying there's nobody providing services in Kansas. We're, you know, supreme workforce shortage. And we're saying, but we're looking at our licensee totals and our numbers continue to climb and climb. So how can we come together and try to figure out what's really going on? And part of this is that the demand for services has dramatically increased, at least since 2020, and that's part of this conversation. But really
I don't
trying.
think this question is going to answer that question.
Yeah.
David.
So I need to jump in here and say it's 2:15 and we really want to get this finished today. And David needs at least 25 minutes and I need to leave at 2:45.
And
So
Linda, I think, you know, if we need to, we can probably just do the whole training next time. If we want to focus on just getting these questions all finished.
I totally want to get these questions
Yeah.
done because I think it's important to get it out there, especially with us on the legislative agenda.
Yeah.
Yeah.
Are you good with that, David?
So,
Okay.
sorry, to get back to that, why are we asking about a percentage then? Why aren't we asking about the total number of hours on average that you're working or supervising or that you have RBTs implementing?
Yeah, maybe it's asking the wrong question. Maybe it really is, are you currently working as a behavior analyst? Then are you working full time in that position or half time? You know,
How many hours a week are you
I think-
supervising?
Yeah, how many hours a
Yeah.
week?
I think you're a lot more direct to just say in a typical month, how many hours are you doing this?
And then
I'm going to
give
go on a
ranges.
right, and then have a range, you know, 0 to 5, 5 to 10, or however you want to break it up. I would say like 10 and under is typically administrative expectation. You know, your 10 to 20, well, 20 to 30 is probably your standard expectation for billable hours.
Yeah.
You're looking for the question of how many, like the services, the amount of services that we're offering. I only provide 17 to like 25 hours a week, but I have a team that's providing nearly 300 across, and that's because I have a BCABA and an autism specialist. You know what I mean? So like, do we care about the 300 number or do we care about the 17 that I'm doing?
Yeah, that was why I asked about whether we're looking for part-time versus full-time who's a supervisor, because I would argue the same thing when I was a clinical director. My direct hours were like 4 a week running the clinic. I would get called only into the high complexity things, but I had 6 BCBAs and like 35 RBTs, and we were running a whole lot of hours out of that clinic.
Yeah.
So if we're after capacity, I mean, I think for the purposes of this survey, asking just for total number of hours is probably good. We could consider a second question, maybe how many hours do you supervise? You know, if you run or supervise a clinical team, how many hours a week are they providing? That may get to what you're after, which is where's the capacity. If I can provide a small tangent, one of the pieces of information we ran down in Texas when we were asked, why aren't there more providers for need? We had a really horrible Medicaid rate. Like BCBAs were getting like 25 an hour. And we needed to document essentially what were we getting from private insurance versus what was the state offering to pay through the mandate to show that it was like a third of what we could get out of insurance. And that was the necessary data point to address some of the, well, you seem to have a lot of people. Why aren't you doing more for this? Oh, you're paying a third of what we can get elsewhere. It was a different issue than capacity. Like I said, I'm less familiar with Kansas's rates and things so far because I'm doing more of the training side right now. But that's the different data point we might consider. I wouldn't say for this survey,
Right.
but because that's accessible more from state budget numbers and things. But if it's getting toward that concern, like we may need to show if the rates aren't high or if you can get twice that, or, you know, we essentially asked our Texas providers, what are you getting private pay? What are you getting from private insurance? What are you getting from state programs? And we were able to show that disparity to show, well, yeah, we have a lot of providers, but not a lot of state providers because we're not paying enough.
Yeah, we did that.
Enough.
We did that, Wes, a couple of years ago. And right now in Kansas, Medicaid pays higher than some private insurances.
Nice. Well done then. Okay. That's awesome.
So
Sorry to throw one last thing in here, but I feel like we need to maybe reword it a little bit to not just say working in the behavior analysis field, because like professors work in the behavior analysis field,
right.
But it sounds like we're getting more at
Clinical.
people who are providing private or insurance funded services to
also
people
care
with
about
disabilities.
the
Yes.
school-based services too, though. So like, I think the
Okay.
face-to-face piece has to come. How many hours are you with a human that is receiving your services?
As long as we're careful with what we mean by human, because like as a professor, I would look at my client if I
Yeah.
had to define a client as a student, and that's not what we're looking at here.
Correct. I would say providing
Isn't it though?
clinical.
Because we're looking at if there's the interaction with other like Kansans. That's what we're trying to protect through doing this, correct? Understanding, or is it just the capacity piece that we're trying to understand here? I guess I don't understand the intention of the question still.
It's the capacity piece, and I think for question 8, it should, if you put clinical in front of services, that's what we're looking at, because we're not looking at, you know, if you're providing school-based clinical services where you're billing insurance companies, that counts. But if you're a BCBA that's working in the school and you're providing school-based academic support, that's not what we're looking for.
Yeah, I think I like that clinical versus direct distinction because I think it's getting at what we're talking about here. If we say who's providing clinical services,
Right.
I think we'll understand what that means. I'll know that a clinical service can be parent training. I'll know that a clinical service can be working directly with a client, but it's not going to be that administrative progress meeting. It's not going to be that supervising a student who's doing those services. Well, it could be that depending on what but I like the clinical aspect. I think that's a cleaner word for what it sounds like we're asking.
Thank you.
David, you're going to want to do, so average is about 100-ish for a full-time BCBA. In a month.
Can we change it to in a typical week?
Yeah. Thank you.
Yeah, I think the week is the way we typically would report that. That's going to be a familiar way to ask it.
And then that next one, which is going to become question 9, it would be, or it's a, you know, subset of question 8. How many hours per week are you supervising clinical services?
I'm being so annoying for this question. I'm so sorry. Okay, so how many hours are you overseeing clinical services? Because me physically being in there supervising and how many hours my RBTs are implementing, those are very different numbers.
Yeah, this one is to get at what Wes was talking about. Like I might oversee a team. I may only have less than 10 hours in question 8, but in question 9, you know, I've got a team of 6 BCBAs out there, and they all have hours that they're doing clinical services, and they have RBTs that are doing clinical services. So on average in the clinic setting or my HCBS setting, I'm overseeing, you know, I've got about 150 hours of services being clinical services being provided under my purview.
So instead of supervising, can it be overseeing?
Yeah, and I think the phrasing that Linda used would be important there too, of like how many hours, maybe how many hours a week of clinical services do you oversee?
There you go.
Implemented by RBTs, other members of the clinical team, etc. And then you can do that same kind of range because I mean, that number can get really big if you're in a big clinic.
So David, it would be how many hours per week of clinical services are you overseeing? And then there in parentheses, it would be e.g. BCABAs, RBTs.
Yeah, I mean, I'm doing some envelope math here, and like for me in my last clinic, that number would have been almost 900 hours a week.
Yeah, mine too. Mine would have been about 1,500.
And Linda, what was the first acronym there?
BC little a. So that's the assistant behavior analyst.
That's the Nikki.
BCABA, BC little a, capital B, capital A.
I heard EGBCBA.
BCABA. Yeah.
A lot of acronyms that I was.
Yeah.
So.
And everybody that's answering this will know what that is. Yep. That's that second class of licensees. We've got the LBA and the LABA. Yeah, that's the LABA.
I think this will be helpful. I'm curious, inserting a question maybe for Tim that just comes out directly and says, do you maintain a license but are no longer working as a behavior analyst, something like that?
Okay. Yeah.
You're going to need to update those ranges though, David.
Yeah, that's what, before you get done. You could leave those, but add more. Like you could say something like, at that point, if it's 30 to 40, after that, you're going to start jumping in numbers.
I wouldn't even have 10 to 30. I mean,
yeah, I wouldn't either. I mean,
that's one case of an early intervention.
Yeah, and I think, if they're a clinical supervisor and they've got exactly 30 hours underneath them, that means they're essentially one RBT for the week. That's really, and that's not really.
But there are people out. Well, there are people out there doing that.
True. Yeah.
We don't want to shortchange them.
Yeah. I would almost think. Yeah.
Could we just leave it open? And it's like an open answer, and we could say, please enter the number of hours that you think you oversee, and then that way we don't have to have a range.
I mean, I think kind of like the acronyms, though, anyone who's doing this is going to know their billables. They're going to know how many hours that they're looking at.
Yeah.
You like that for both? Open answer for both?
I think if you leave that in question 8, then it's quantifiable and we can just run a report on it, right? Because it's going to generate out, and that gives us our 85% of people work, anywhere between 20 and 40 hours a week of direct clinical services.
Yeah, I think though that's the same argument to make for 9. If we make it open-ended, then we give ourselves a lot more work on the tail end to analyze it. I think having a range is
That's true.
easier on the tail end. And I don't think like it. Maybe it's a none, 10 to 50, 50 to 100, 100.
Yeah. And
If you get up over that and maybe 500 mark, there's not going to be too many people. Well, I don't know. I don't know that for the state of Kansas, how many people have the really big clinics that that are running 1,000 hours a week.
I don't think there are that many that are running unless they're here in the Kansas City area.
Mhm.
But in most of Kansas, the answer is going to be very few.
Good.
Yeah.
There's like 5 in Wichita.
Yeah, so it might be worth giving the option for the bigger numbers. But then we could see that. I mean, we might be surprised.
And I'm just going to throw this out here because I misinterpreted this question, so I wonder if others might too. When I read question 9, I read it as like clinical services that I'm overseeing, meaning that I am there supervising, as opposed to, it sounds like you all are talking about like, this is a client's case that I manage, so I would count all of their hours, but like I'm never present at all 40 hours of that client's.
Yeah, I think that was exactly what I was worrying about and looking for with the word to say, like, it's not just supervision, it's like overseeing. It's I think managing, you said managing, that might be the better word. How many hours are you responsible for overseeing / managing?
Yeah.
To make clear, we're looking for all of your clinical capacity.
Yeah. Yep.
I mean, another way to ask it would be to say, what is your clinical capacity? Like in your practice, what is your weekly clinical capacity and billable hours? That gets directly to what we're after, but it doesn't give us the granular who's doing it that we get with 8 and 9.
So I would suggest that we put, David, if you put that range underneath number 9 for now and do it in 50 increments, like less than 50 hours, 50 to 100. So it'd be less than 50. And then 50 to 100. And then maybe, then at that point, maybe 100 to 200, because now you jump 100 and you've got a bigger range.
Now, were you want to change that to, are we still talking about during a typical week?
Yeah.
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 Yeah. And I think then once you get it maybe over 200 to 300 and then 300 plus, like I said, if we don't anticipate having a lot of the really big clinics, then cap it at like 3. I'm trying to do the math on a 20-hour week for an RBT or 20-hour program, but that would make it weird. I think the even makes more sense.
So you might say, David, change that to over 300 hours and put another one in between there that says 200 to 300. Yeah, 3,000. All right.
You're so good at making changes with all the suggestions. I have one more suggestion.
Sure.
Can we change it to how many hours per week of clinical services, and then put the parentheses back after that and implemented by BCBAs and RBTs instead of at the end?
Okay.
So you can just move the EG, the parentheses, implemented by BCABC and RBTs, and then delete the ones at the end.
Yeah. All right. And then, so I want to give everybody the heads up. It's 2:32 and we've got 2 more questions at least to get at. Well, we need to look at question 10. Are you good with that? But we also have question 14 and 14.1. And we need to, we have.
So I also have a suggestion, like question 10 should go before question 8 and 9. If they select no, they don't really need to answer question 8 and 9.
Yeah. Can you do skip patterns?
I'm not sure. You mean in terms of a survey tool?
Yeah, like to say it, like under question 8, if you answer no, skip to question.
Well, I think we've got the none options in 8 and 9, though. I agree with moving question 10 up above them, but I think if we don't have the survey logic to make it automatically skip, better to force their answer with a none and be sure they read it
Yeah.
than
Okay. Well, question 11 talked about the multi-state compact. This presents a scenario where a multi-state license would be twice the cost of a single state license. But I could just say if a multi-state license was more expensive than a single state license.
Are we thinking it's going to be twice the cost?
Probably not.
Okay.
That was sort of establishing a ceiling for the social work one because we figured, if it costs a certain amount of money to practice in one state, the most you'll probably spend to practice in all states would be essentially 2 license fees. But now, what it's looking like is more of sort of like an add-on for social work. So if we change the language of this instead of a multi-state, would you be interested in obtaining a multi-state license if the cost was more expensive than a single state license?
I think that the twice is fine. That just was a lot. It does give like some
Not
context
specific
around
if
it.
we don't know how much it's going to cost.
Yeah, I mean that's kind of the tricky
It's like
thing.
if you say twice as much, like, well, that depends. What other state are you licensed in? If you're licensed in Missouri and it's cheaper than Kansas, then no, it's not worth it.
Mhm.
Yeah, I would say as someone who is licensed in multiple states, this is one of the more expensive states. So if you double it on me, I'll probably not want to do that.
But it's going to include your Missouri license, hopefully.
Yeah, but if Missouri is cheaper, like you said, or Oklahoma significantly cheaper, if I've got to pay double if I got to pay double for the Kansas license and I get both Missouri and Oklahoma, it becomes worth it.
That's what I think the multi-state compact does is
Mhm.
you become a member of the compact, you pay
Mhm.
more for your license, even if it is doubled, but you can practice then in all the other states that are a
Yeah.
part of that compact.
Yeah, I think that's an important clarification to make, that it could be multiplicative. It's not just double and you get one other state. It could be everyone in the compact, which I think is an important clarification on that doubling of the fee.
Would this be an opt-in or opt-out option too? Or if we don't know, it might be worth saying, like, if you have multiple licenses, would you be interested in a multi-state compact?
Yeah, as the preamble to the question. So at the beginning of the sentence, so it would say, if you hold licenses in more than one state.
Would you like to do this?
Like right before A.
Hmm.
There you go.
Yeah, I like that.
Like
So
I only
if
have
you
one
hold
license.
licenses in more than one state.
I guess my question is that does that mean that if I only have one license, I don't get to weigh in on that question? Like I might want to get one if actually there is a multi-state compact I can.
That's my thought. But
So then if you have more than one license or you're interested in pursuing that,
yeah.
would you do this?
Instead of, what could probably prevented me from getting it is probably I have to do one state at a time, right? But this would open a door, basically.
David, so put your cursor in front of the word would, the beginning of the second sentence. Right there, hit enter. So the first part is defining what a multi-state compact is. The second sentence is the question. If you hold multiple licenses or would be interested in holding multiple licenses, would you be interested in obtaining, and we can wordsmith it. That's where that would go. Is that what I'm hearing everybody saying?
I agree with that. And then one more question is, I don't know what other professions do, but I imagine cost is only one component that changes with this. Would you need to be, for example, fingerprinted and hand in all of those documents that you need in Missouri, or once you do it in one state? And if you don't need to do that, that might be another component to add to this question. So in addition to, it may be more expensive, but you don't have to do all of these other regulatory things to get that
Right.
license.
That's the way psychology works, is once you opt into a multi-state compact, then you now have the authority to practice in the other states that are part of that compact. Because the other states have opted in with the understanding that our licensing process is similar enough to theirs that they feel comfortable accepting people from other states. I think it's
I think that's
I
great.
don't think we need to ask if you have multiple lessons or one lesson, because I just realized question 5, we actually asked them, how many lessons do you have? So I think we should just ask that simple question, are you interested? Because we're not like trying to explain all the factors and ask them to make the decision. So I think how interested they are, and we can link their we can do the analysis and see, depending on how many lessons they have, how their answers could be different.
We would just need to make sure that we don't report the answers to the raw answers to this question, and that we do analyze if they have more than one license. I guess my issue with that is if I have only one license, you're going to tell me it's more expensive. No, I don't want that. But you're not our target audience. Our target audience are those that are pursuing or have more than one licensure in other states.
Mm-hmm. Yeah, we can do more in-depth analysis.
Yeah, the answer to the earlier question doesn't get at the do you want to pursue licenses either.
I mean, part of this could be that we don't know exactly what percentage of licensees hold several licenses, right? So if it was that 50% of our licensees were only licensed in Kansas and they don't intend to get a license somewhere else, a multi-state license doesn't really probably offer them very much benefit. But if you are licensed in at least 2 states currently, and you could stop paying the license fee in the second state, that would be helpful for you. But maybe some people, if we just asked everyone, they would say, well, I'm not interested because of the cost factor, or other people because it wouldn't help them out with their practice, I guess.
So does everybody want to add before the question, if you are pursuing or maintain licenses in multiple states, would you be interested in obtaining a multi-state license if the cost was more expensive than a single state license, but less expensive than holding a license in 2 or more states?
Are we really interested in if cost is the factor, or do we just want to evaluate interest? If we just want to know how many people among licensees might be interested in doing this, we don't need any of that language about cost. We can just say, are you interested in this?
All right, I'm good with that. So then, if you are pursuing or are licensed, David, at the beginning of that sentence, if you are pursuing or are licensed, blah, 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 and then just get rid of the last part of that sentence that says, if the cost of a multi-state license was more expensive. Yes.
And then it's just a yes, no, and if they want to make a comment, we get another easy answer.
And then I need to ask a question, a process question. I have a hard stop at 2:45. Do you think we can answer the other questions in 3 minutes? And if not, David, what are the procedures around this? Can I designate someone to close the meeting for me?
I think we would probably have to end the meeting. There was a delegation motion that allowed a public member to basically serve as chair in an extreme case, but unfortunately our public member couldn't attend the meeting today. So
Right.
without a board member present, we probably have to end the meeting. But
Okay.
Are we allowed to submit feedback via email, or does it have to be in the context of this meeting?
so you can send me feedback. Maybe that would be the cleanest way to do this. If you do have comments about the remaining questions, maybe just send an email to me directly. And I'll kind of look at all those items and try to take the feedback and make some final adjustments to some of these questions. And Linda, if you're okay with it, I'll maybe reach out to you and then you and I can talk about it. And then we can just kind of make a final adjustment to the survey and then get this out in the next maybe week or so.
I am okay with that. Are you guys all okay with that?
Yep.
Yep.
Yes.
So you don't think I'll put something hinky in there?
David, can you like send the most recent version out?
Yes.
Thank you.
I'll go ahead and I'll save this and I'll send it to everyone. Just
Do we need a motion to and vote to allow this as the resolution? So move that we accept the resolutions, that you'll do this and then vote on that so that you have the committee's essentially approval?
I think we can do general consensus, right?
Okay.
David?
Yeah.
Just wanted to make sure we cover ourselves procedurally.
Well, procedurally, that would be the way to do it. Like, do I
Okay.
have a general consensus that that process is okay?
Yeah.
And I don't see anybody opposing, so it doesn't need a
Perfect.
whatchamacallit. Thank you, Wes. So at this point, I suggest we move all the other business to our next meeting agenda and take a motion to adjourn this meeting.
But
Wait,
before we,
so sorry. Can we talk about the April 11th meeting really quickly?
I have to leave. It's 2:45. Sorry. Hard stop, 2:45.
Okay, I will not be at April
Sorry.
11th, nor will most people. So
Sorry.
all right.
motion to close. Here we go.
All right. So the next meeting is not December 13th. It's next month or in 2 months.
I will correct that. It is in February.
Yeah.
It should be on your calendar. So yeah.
Okay. Do I have a second to Allison's motion? Thank you, Wes. All in favor for accommodating Linda's need to leave a hard stop at 2:45. Thank you guys very much. Meeting is adjourned. Thanks for the discussion. Sorry.
Have a good weekend.
Thanks, everybody.
Yeah.
Bye.
Here.